Have you ever wondered how something as personal as masturbation could impact your health, especially when living with hypertension? It might seem like an uncomfortable topic to consider, but the truth is, understanding how our bodies respond to intimate acts is crucial for maintaining both our physical and emotional well-being as we age. If you're over 50, managing hypertension, or simply navigating the complexities of growing older, this conversation could be a game changer for you. In today's video, we'll explore how masturbation, often viewed as a natural and healthy part of life, intersects with hypertension and the vital role it plays in your overall health, particularly in your later years. We'll cover the surprising benefits of masturbation in managing stress, improving mood, and even supporting heart health when practiced mindfully. But more importantly, we'll dive into how you can enjoy this form of self-care while keeping your blood pressure in check. By the end of this video, you'll know the risks, the rewards, and how to engage with your own body safely, empowering you to make informed choices that support both your physical and emotional well-being. Whether you're dealing with hypertension or just want to better understand how your body reacts, this video will provide you with the tools to balance pleasure and health, so you can live your life with vitality and confidence. Stay with us as we discuss practical tips, the latest research, and what you need to keep in mind when enjoying this essential, yet often overlooked, aspect of life. Don't miss out. This could be the key to unlocking a healthier, happier you. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. As a sexologist and physician, I feel deeply honored to speak with you today about a topic that is both intimate and vital for your overall well-being: masturbation and its connection to living with hypertension. This conversation is more than just a clinical examination. It's a profound discussion about how we, as individuals, can care for both our physical and emotional health in a way that promotes balance, longevity, and deep fulfillment, especially as we mature and navigate the complexities that come with life beyond the age of 50. Hypertension, often referred to as high blood pressure, is a condition that affects millions of individuals worldwide, with a particularly high incidence among those over the age of 50. It's an invisible force that can quietly take a toll on our bodies without our even realizing it at first. Essentially, hypertension occurs when the force with which blood flows through your arteries is consistently higher than what is considered normal. Over time, this excess pressure can cause significant damage to your blood vessels, leading to a cascade of complications including heart disease, strokes, kidney failure, and other life-threatening conditions. For those of us in our later years, managing hypertension becomes one of the most important aspects of our daily lives. As we age, we may find ourselves increasingly aware of how our bodies feel, of how our physical state can influence our emotions, our relationships, and our sense of identity. This awareness extends to all aspects of our lives, including our sexuality. Sex, intimacy, and the simple act of connecting with our own bodies are often considered less frequently as we grow older, yet they remain essential to our overall health and happiness. Masturbation, in particular, is a natural and healthy way to engage with one's own body, reduce stress, release tension, and maintain a sense of well-being. However, as with all things related to our health, it is crucial to understand how these acts of self-care can affect our bodies, particularly when living with hypertension. When it comes to hypertension and masturbation, I want to reassure you from both a professional and personal perspective that masturbation itself is not inherently harmful to those managing high blood pressure. It's a natural expression of our sexuality, an essential part of our physical and emotional lives that should be embraced and nurtured. However, it's essential to understand how your body responds to sexual activity, especially when it comes to your blood pressure. It's not just about the act itself, but how your body's cardiovascular system reacts to the excitement and physical exertion involved. A study by the American Heart Association shed some light on this, finding that sexual activity, whether with a partner or during masturbation, can cause a temporary spike in blood pressure. This is due to the excitement and physical stimulation that occurs during these moments. Your heart rate increases, your blood vessels dilate, and your body responds to the rush of pleasure and emotional arousal. These responses are entirely normal and natural. It's part of how our bodies are designed to engage with the world and with ourselves. However, the key to navigating this experience as someone with hypertension is understanding how your body responds to these fluctuations in blood pressure and making informed choices. What I want to emphasize here is that the temporary increase in blood pressure that occurs during masturbation is usually not a cause for concern, unless there are underlying health complications or if your hypertension is not well controlled. For most individuals with well-managed hypertension, there's no reason to avoid masturbation or sexual activity. In fact, when practiced mindfully and with awareness of your body's limits, masturbation can be a source of relaxation, emotional release, and even a positive impact on your overall health. The emotional and psychological benefits of masturbation are profound as well. In addition to the physical effects, the act of connecting with your own body can help reduce stress, ease anxiety, and improve mood. For many people, it's a form of self-care that provides a moment of intimacy and connection with themselves, which is crucial as we age. Maintaining a healthy relationship with our bodies and our sexuality is part of nurturing our self-esteem, our sense of dignity, and our emotional well-being. There's another layer to this as well, which I want to explore briefly: the importance of understanding and respecting your body's signals. If you have hypertension, it's vital to monitor your blood pressure regularly and adhere to the medical guidelines your doctor has provided. This means maintaining a healthy diet, staying active, managing stress, and taking any prescribed medications. It also means being mindful of how your body responds to physical activity, including masturbation. If you notice any unusual symptoms, such as dizziness, shortness of breath, or chest pain, during or after masturbation, it's important to consult with your healthcare provider. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. In general, if you're maintaining good control over your hypertension and following your doctor's recommendations, there's no reason why masturbation should be off limits. On the contrary, it can be an important part of your self-care routine, a way to maintain your physical and emotional health, especially in the later stages of life. So, I want to leave you with this: as we age, we learn to appreciate our bodies for all they've given us over the years. It's a journey of self-acceptance, self-awareness, and growth. Masturbation is just one of many ways we can engage with ourselves in a healthy, respectful, and loving manner. It's not only about physical pleasure but about embracing our sexuality as a source of healing, joy, and emotional nourishment. By understanding the relationship between hypertension and masturbation, you can make informed decisions that support your overall health, keeping both your heart and your emotional well-being in the best shape possible as you navigate the years ahead. Ultimately, the goal is not just to survive but to thrive, to live a life that is full of vitality, pleasure, and peace of mind. And that includes the freedom to experience all aspects of our humanity, including our sexuality, as we continue to age with grace, wisdom, and resilience. However, it's crucial to exercise caution if you have uncontrolled hypertension or are currently in a critical phase of treatment. Hypertension, when left unmanaged or poorly controlled, can lead to life-threatening events such as heart failure or strokes. During periods of intense excitement, such as those experienced during masturbation, physical stress can trigger a sudden spike in blood pressure. For someone whose hypertension is not well controlled, this spike may pose a significant risk. This is why, if you're navigating such a critical phase of treatment, you must be especially mindful of how your body reacts to these physical and emotional experiences. Remember, masturbation, much like any other physical activity, involves exertion and effort from your body. It's not a passive experience. It's an active one that can elevate your heart rate, increase circulation, and involve a degree of physical stress. While for most, this isn't dangerous, it's essential to be attuned to your body's signals. If you feel chest pain, dizziness, shortness of breath, or any other discomfort during the act, you should seek medical attention immediately. These are red flags that should never be ignored, as they may signal an underlying health concern that requires prompt intervention. But this conversation isn't just about the physical risks. it also involves the emotional and psychological dimensions of health. When you feel anxious or stressed about your hypertension, or any health condition, it can create a cascade of tension within your body. This stress can interfere not just with your physical health, but also with your sexual life. The worry and fear surrounding your health can make it difficult to fully relax and experience pleasure. It can make you withdraw, either from your own body or from intimacy with a partner, leading to complications in your self-relationship and emotional well-being. And this isn't something to dismiss. It's a real challenge that many people face as they navigate their health concerns in later life. This is why it's so important to take care of your emotional health, too. Masturbation, like any other sexual activity, can be a healthy outlet for releasing tension and reconnecting with yourself. When practiced consciously, when you approach it with self-respect and an awareness of your body's limitations, it can serve as a powerful tool for relaxation, stress relief, and emotional balance. By giving yourself permission to enjoy the pleasure that comes from such a personal experience, you can soothe your mind and help reduce the anxiety that often accompanies health issues. In this way, masturbation becomes more than just a physical act. It becomes a means of emotional self-care. When we talk about masturbation in older adults, it's important to stress that this practice is not only safe, but also potentially beneficial. As long as it is done in moderation, and within the context of maintaining good general health, masturbation can offer profound physical and emotional benefits. For many, it serves as an essential part of maintaining a sense of vitality, joy, and intimacy. In fact, numerous studies suggest that solo sexual activity in older adults can significantly enhance overall well-being. Masturbation triggers the release of endorphins, those feel-good hormones that boost our mood and help to reduce stress. When you engage in this natural and healthy activity, your body is flooded with these chemicals, which not only improve your mood but also help to decrease anxiety. Furthermore, regular masturbation can contribute to better sleep quality. Sleep is critical in maintaining healthy blood pressure and overall cardiovascular health, and the relaxation that follows sexual release can help you unwind and fall into a deeper, more restorative sleep. An article published in the Journal of Hypertension highlighted an interesting observation. People with well-controlled hypertension who engaged in moderate physical activities, including masturbation, had more stable blood pressure and reported lower stress levels. This is because masturbation can be seen as a form of light cardiovascular exercise. While it temporarily raises heart rate and blood pressure, these changes are short-lived and typically return to baseline quickly. For those whose hypertension is well controlled, these temporary increases in blood pressure do not present a significant risk. In essence, masturbation can function as a mild, short-term cardiovascular workout. For individuals managing their blood pressure through lifestyle changes, medications, and regular monitoring, this mild increase in heart rate and blood pressure is unlikely to be harmful. In fact, it may contribute to the overall positive effects of regular physical activity, helping to keep blood pressure within a healthy range while also providing the emotional and psychological benefits of intimacy and stress relief. As you age and continue to manage hypertension, it's important to see your sexuality not as something separate from your health, but as an integral part of it. Engaging with your body through masturbation can be an act of self-care, contributing to both your physical and emotional well-being. It's a way to stay connected with your body, relieve stress, and maintain a healthy level of intimacy, whether you're by yourself or with a partner. In doing so, you embrace not just the act of pleasure, but the full spectrum of health that includes relaxation, emotional fulfillment, and a deeper connection to your body and your own sense of vitality. So, while it's essential to be mindful of your hypertension and health status, there's no need to deprive yourself of the benefits that masturbation can offer. In fact, with the right balance of caution, awareness, and self-respect, masturbation can become a positive and supportive practice in your journey toward maintaining your health, happiness, and peace of mind. That being said, it's absolutely crucial to remember that every body is unique. Our individual health profiles, shaped by genetics, lifestyle choices, age, and underlying medical conditions, can all affect how we respond to physical activity, including sexual activity like masturbation. Some people may experience a more pronounced increase in blood pressure due to genetic factors, the severity of their hypertension, or other chronic conditions that might accompany high blood pressure, such as diabetes or kidney disease. For others, even slight increases in physical or emotional arousal might be enough to trigger a spike in blood pressure. Therefore, it's essential that you pay close attention to how your body responds during any type of sexual activity and remain vigilant for any signs of distress. If you notice any concerning symptoms or feel uneasy about how your body is reacting, don't hesitate to reach out to your healthcare provider. Now, let's take a closer look at what happens when hypertension is left uncontrolled. If your blood pressure is poorly managed or not managed at all, the risks associated with activities that elevate blood pressure, like masturbation, become much more pronounced. Masturbation, much like any other sexual activity, stimulates a series of physiological responses in the body. These include an increased heart rate, heightened blood flow to the genital area, and a temporary rise in blood pressure due to physical exertion and emotional arousal. For those with uncontrolled hypertension, this temporary rise in blood pressure could be more dangerous, as it could strain the heart or trigger a number of cardiovascular events. In particular, the heart may have to work harder to pump blood under high-pressure conditions, which could potentially lead to a heart attack, stroke, or other serious health problems if left unchecked. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. For individuals with severe or uncontrolled hypertension, these effects could be more significant. The sudden and often intense rise in blood pressure during sexual activity could place an unnecessary burden on the heart and arteries, which may already be compromised by high blood pressure. This is why it's especially important to consult with your doctor before engaging in any form of intense physical activity, including masturbation, if you are in the midst of managing severe or uncontrolled hypertension. Your healthcare provider is the best source of guidance when it comes to understanding the potential risks and developing a plan for managing them. In some cases, your doctor may suggest reducing the frequency of sexual activity or might recommend other forms of relaxation that place less strain on the cardiovascular system. Understanding how to safely navigate these situations is crucial. So let's explore some practical steps that you can take to enjoy masturbation in a way that prioritizes your health and well-being, especially when you have hypertension. 1. Control your blood pressure. Maintaining well-controlled blood pressure is absolutely essential to mitigating the risks of sexual activity, including masturbation. This begins with following your doctor's recommendations for managing your hypertension, which might involve taking medications as prescribed, adhering to a balanced and healthy diet, exercising regularly, and avoiding triggers like excessive salt intake or alcohol. Additionally, ensuring that you regularly monitor your blood pressure will help you track how well your efforts are working. If you've been struggling to manage your blood pressure, speak with your healthcare provider about potential adjustments to your medication or lifestyle. Remember that keeping your blood pressure under control doesn't just minimize the risks associated with sexual activity. It also reduces the likelihood of developing other serious conditions like heart disease, kidney disease, or stroke. 2. Listen to your body. Our bodies are constantly sending us signals, and it's important to tune into them. During masturbation, or any sexual activity for that matter, it's vital to be aware of how your body is reacting. If you experience any signs of distress, such as chest pain, dizziness, shortness of breath, lightheadedness, or discomfort in any form, it's important to stop immediately. These are red flags that your body is under stress, and you should seek medical attention right away. Remember, masturbation, while generally safe for most people, is still a form of physical exertion and may impact the body's cardiovascular system, especially for those managing hypertension. Your doctor may recommend taking breaks or changing your approach if you experience these kinds of symptoms during sexual activity. It's essential to not push through discomfort in the hopes that it will pass. Addressing these symptoms promptly is the best way to protect your health. 3. Relax and enjoy the experience. Masturbation should not be a source of stress or anxiety. If you find that it's causing you stress or that you're overly focused on worrying about your blood pressure, it's time to reframe your approach. Masturbation, like any sexual activity, is meant to be a pleasurable, relaxing experience. If it's becoming a source of tension or fear, You might want to try creating a more calming and soothing environment or engaging in mindfulness practices beforehand to help you focus on relaxation. Creating a mental and physical space where you feel safe and at ease can significantly enhance the experience. Stress and anxiety can negatively impact your sexual enjoyment and can even hinder your body's response. Try using breathing exercises, progressive muscle relaxation, or meditation techniques to calm your mind and reduce the emotional tension associated with hypertension. 4. Consult your doctor. It's always wise to discuss any concerns you have about your sexual health and hypertension with your doctor. Your healthcare provider can offer tailored advice that takes into account your specific health status, the severity of your hypertension, and your overall medical history. This personalized guidance is invaluable because it helps you make informed decisions about your sexual well-being, while also taking the necessary precautions to protect your cardiovascular health. You may also benefit from seeing a sex therapist or a counselor who can help you work through any emotional stress or psychological barriers related to intimacy and sexual pleasure, particularly if you're feeling anxious about your health. Your doctor may also recommend specific exercises, relaxation techniques, or changes to your treatment regimen that could make your sexual experiences more enjoyable and safe. Having an open dialogue about these concerns can help reduce anxiety, improve your emotional connection with your own body, and ensure you're engaging in safe, satisfying activities. 5. Remember the benefits of moderation. Finally, keep in mind that moderation is key. Masturbation, when done in moderation and with a mindful approach, can offer numerous physical and emotional benefits. For instance, it can promote relaxation by helping to release endorphins, the body's natural feel-good hormones, which reduce stress and elevate mood. Regular masturbation can also improve sleep quality, a vital component in maintaining healthy blood pressure and cardiovascular health. This practice helps to lower overall stress, leading to less anxiety about your health and a more positive outlook on your overall well-being. In conclusion, while masturbation can be a healthy and enjoyable part of your life, even with hypertension, it's important to engage in the practice safely and thoughtfully. By taking the proper precautions, such as controlling your blood pressure, listening to your body's signals, practicing relaxation, and consulting with your doctor, you can continue to enjoy this intimate and fulfilling activity while safeguarding your health. If you experience any discomfort or have concerns, don't hesitate to reach out to a healthcare provider. With the right care, you can prioritize both your sexual health and your overall well-being, ensuring a fulfilling and balanced life. I hope you've gained some valuable insights today. Whether it's learning how to better care for your health, embracing independence in later years, or understanding the importance of self-worth, it's clear that aging can be a beautiful journey if we approach it with wisdom. What's one thing you've learned today that you'll bring into practice in your own life? Drop your thoughts in the comments below. If you liked this video, please leave a comment, and don't forget to like, share, and subscribe to our YouTube channel for more content. Thank you for watching.